You think having gone digital has affected your workflow, how you practice the profession on a day-to-day basis?
Well, all the changes have been really positive. I can't believe all the benefits that we've achieved so far. The improvement in our efficiency or efficacy, knowing that we are doing a better job and a better service to our patients. And it's just, I can go on and on and on, telling you how much my life, my work, and my perspective of what I'm doing has improved since we became digital.
And people sometimes are reluctant to believe that a digital workflow associates with an increase in productivity. Some people say that, well, I'm faster on the microscope than I would be on a digital screen. What's your take on that?
With these studies, you can just do a Google search. No need to do even a fancy PubMed, but just do a Google search and you're going to see all these different articles that have been produced by people actually doing it. And we did it, and we discovered that, for instance, we save 2 hours just in delivery. So meaning if you're digital, you get 2 hours ahead of your peers just in receiving your cases. And from there, everything is just win, 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 win. Consults are faster. Immunohistochemicals are faster. If you want to, instead of running to your neighbor or across the building looking for a consult, you just poke somebody online and get your consult right away. Yes. Not to mention if you need to send it to an expert to another hospital, that used to take days. Now it takes minutes. And again, I can go on and on. It's just a matter of getting informed. 3-4 years ago, I can say, yeah, there were not enough data. You could kind of say, oh, I don't know, maybe it's going to slow me down, but no, there is now proof. And individually, as pathologists, you just need to get used to it. But when you do, you realize that you actually become faster.
So getting used to digital signing out is a matter of only a few short hours, days, rather than perhaps weeks or months, which is something that people do get worried about. Because obviously you've been using the microscope for 10, 20, 30 years, and your worry is, will digital pathology slow me down?
Probably for 1 day or 2. I would say maximum a week. But after a good day of doing it, you're an expert. There is nothing really to learn that you are not used to. All pathologists know how to use a computer, how to use a mouse. Maybe you have to explore between different mice and how you become more efficient. But again, it's just a matter of, in 1 day, you get used to all the different steps. And then in a week, probably you can try different methods. And by the end of a week, you're a pro.
Another question that new pathologists considering digital workflow, one of the topics that keeps cropping up is, well, but you're actually introducing an additional step in the workflow by digitization. So how come that you get your cases 2 hours quicker on a digital workflow?
Yeah, that was something that we just proved. And the reason behind it is that our laboratory works 24/7. So the biopsies that get taken today, by the end of the day, they are all accessioned, engrossed, and processed. And by some time in the middle of the night, they will come out the processor all stained. And at that time, our workflow now, after slide production, they go directly into imaging, which scanners are right next to the stainers. So they just go back some point in the middle of the night, and at that point, they start populating everybody's queue. So if you cannot sleep, you can get up, wake up, get up, or if you cannot sleep, you can get up and start signing out at that time. And some people do it to their advantage. If they have something to do during the day, they wake up really early at 6, 5 in the morning, and they can guarantee that by mid-morning they will be done with all their cases, and they can plan much better because again the cases go directly from production to your computer wherever you are, at home, in the hospital, in the other side of the country. And that's the beauty of it, the
Yeah.
mobility and the freedom.
Because it sounds as if some of your colleagues actually can at least sign out or do something with your caseload from home.
Yes, and like I personally prefer to go to the office because I focus much better that way, and I think everybody does. Like they keep coming to the office, but again, you have the flexibility to start early from home, or if you have something else to do, you can do your run your errands, go home and finalize whatever you have pending, either stains or dippers, but you don't have to be, you're not attached to a microscope anymore, and that's the main point.
Artificial intelligence in pathology for routine diagnostic use is around the corner. And in fact, now we have FDA approved solutions licensed in the United States for routine clinical use. How do you think that's going to affect how pathologists actually work?
Well, it's going to be the next step in diagnosis. I think it's going to make us even more efficient. It's going to give us a new set of tools to step up our diagnostic capabilities. And I think overall it's just going to be a whole new level of diagnostic medicine, pathology. And I'm very excited. In fact, one of the excitements for me, the major excitement for me when we were digital, it wasn't the fact that I was going to sign out from home, or I was going to save some time, or the fact that I was going to move from this position to this position. All these things are great, but the main driver for me was the seeing in the horizon AI, and because that's going to just take away all the subjectiveness of our profession and give us more objective tools to analyze the tissue.